So then what I used was to find out the underlying emotions of the refractive errors. And there's a pattern. And when you find out this underlying emotion, then you can find out with a timeline the shock, the significant emotional event. And when you know what happened, when you know what belief came out of this situation and what emotion, then you can solve it. So let's get specific to short-sightedness, because that was the question about. With the eyes, with the refractive errors, we can make it very simple and easy. Every refractive error means that a certain distance you have got a good vision. And it means that the location where you see sharp has to do with the relation. That is where you want to see somebody. So a short-sighted person wants somebody to be near, because a short-sighted person can only see clear in short distance. So they want to be close to somebody, because in the past they lost somebody out of sight, and that was a shock for them. I had a colleague, a doctor, a medical doctor, who grew up in former East Germany, and one day his father, who was politically active, the secret police from East Germany, the Stasi, came and just took him away and brought him to prison. And that was a shock. And after that, he developed short-sightedness, because he lost his father out of vision when the secret police came and just took him away. And that was the moment where he had this shock. So everybody who is short-sighted in his life has such a situation. Most of the times it's in early childhood. And when you can identify this moment and you can find out what emotion was there, then with EFT, with hypnotherapy, with other kinds of techniques, you can solve this emotion. You can free yourself out of this frozen in the past, and you can let the past go. You can regulate that, and you can also overcome your refractive error. When you also start doing training for the eye muscles so that they get in action again and they're not frozen when this shock happened. So that is possible, and especially EFT has shown good results with it. So,
Dr. Kwesi, with astigmatism?
Yes, so that is short-sightedness. You lost somebody out of sight, you want the person near, and the more the refractive error is, the more short-sighted you are, the closer you want that person. With astigmatism, it has to do with, you have to understand the nature of astigmatism. With short-sightedness, it's very easy. Far vision is blurred, near vision is according to the power of the short-sightedness, okay. With astigmatism, it's different, because the main aspect of astigmatism is distortion. And those of you who have done NLP, what we also really recommend everybody who is in mental health also to get basic training in NLP. Those of you know that distortion is one of the filters we use. And this distortion is also shown on the level of the eye. And that is what we call astigmatism. A distortion happens when a person is confused between 2 or 3 or even more opposing belief systems that are in contradiction. One example, a very good friend of mine, he was very ill. He had a failure of the kidneys and needed to go to the dialysis 3 times a week. His blood had to be washed with a machine, and he had a son. And for his son, the father was the hero. Yeah, he was the man in the house, and he was the protector and the savior of the family. That was his belief about his father. That was the image he had about his father. And one day the family went to visit him in the clinic where he went for the treatment of his kidney failure. And he saw him, the blood dripping out of him, going to the machine, and the blood going back in his body. And the father was pale and looked as he was almost dying. That was a shock. So on the one side is the image of my father, the protector of the family, and on the other side, he saw his father almost dying. So two images of the father which were in contradiction, and both were real for him. So in order to identify with both these opposing images of his father, he developed astigmatism. Because astigmatism is you don't only have one focus, you've got more foci. And this shows as a distortion. So with this distortion, he can see his father being sick, and he can also see his father being the strong protector of the family. So astigmatism means there is a distortion because of contradictory belief systems, and where the person can't let go one of the images. He's stuck to all the images he has, even if they're in contradiction, and the person can't let go. And that creates a distorted view of reality.